happy and smiling and could light up the room. She never really complained about anything, which always surprised me because she had so many things going on in her life that I wanted to hug her all the time. I didn't find out until I was much older that she was actually suffering so much more than I could even realize. When I had gotten a bit older, it was just a year or two ago, I had found out that she actually had Alzheimer's. And it was really eye-opening for me because I had realized when I thought about it, I saw all the signs. I saw her not remembering me when I woke up the next day to greet her. I saw her forgetting to eat all the time. I saw her so exhausted because of not eating that she would just go to sleep constantly. And I saw her husband just smiling the whole time because he said he got to fall in love with her again every day, which broke my heart because when we had left to come back home, we had gotten a call a couple months later that she was hospitalized. It was either from not eating enough or from the stroke that she had gotten, but it also could have been a combination of both, honestly. The stroke had caused the Alzheimer's to progress more rapidly, and she ended up dying a year later. And then, not too long after, my great uncle died of pancreatic cancer, but we all just believe he died from being heartbroken. So today, I'm going to be talking about Alzheimer's. First, I'm going to be discussing about the history of it, and then I'm going to be discussing the symptoms and also treatments. So most of you, probably all of you, I'm guessing, probably know about Alzheimer's, at least a little bit. If you don't know, it is a disease that progressively gets worse as you get older. So there's early onset Alzheimer's, which you can get from before you're 65, and then obviously there's the late onset Alzheimer's where you can get it way after 65. Alzheimer's is also known as the senile dementia. I just thought I should probably put that up there. So going back to my great aunt, I'm just going to be talking about early onset Alzheimer's today because that is actually what she got. She was a school principal and also an English teacher when she found out, and she had to quit her job, which sucked for her because she was trying her best to get by with her husband also not having a job. Sorry, I'm shaking. Okay, so okay, I'm going to be talking about first the history of Alzheimer's and how it became to be. In 1906, Dr. Alois Alzheimer's, a German psychiatrist and neuropathologist, had a patient. She was just called Auguste. She was 50 years old, so she had early onset Alzheimer's. And for 4 years, he watched her and took in-depth notes. In Tübingen, I think I'm saying that correctly, Germany. So for 4 years, he watched her progressively get worse with memory loss. She was emotionally and psychologically just not there all the time, and that was just one of the main things that was going on, that he saw. So he did an autopsy on her after she died in 1904, 1905, and he found that the neurons and networks in her brain, sorry, I forgot, it just shrunk and just like fried basically, so that's how that looks. Okay, so basically he did this talk at a university, and no one cared for like what he wanted to talk about, obviously, what he was talking about, his findings. And when it came to the end of his speech, the chairman of the university where he was talking, he only asked once or twice if anyone had questions or comments or anything, and then that's how much attention basically Alzheimer's had been getting, and it's still getting. Like even 100+ years now, it still doesn't have the attention it deserves, or like the people working on it as much. Okay, I'm going to be talking about the symptoms now. Obviously, one symptom is the memory loss. There's also confusion, weight loss, dizziness, tiredness, basically all that. And so, changes in mood, the social withdrawal, the poor judgment, all of that are symptoms of just like regular Alzheimer's, not like severe Alzheimer's. The severe Alzheimer's has symptoms that include the ability to communicate, weight loss, seizures, skin infections, difficulty swallowing and breathing, and those are just to name a few. As you can see, there's the certain parts highlighted of where the Alzheimer's affects the brain. Okay, I'm going to be talking about the treatments that one can receive with Alzheimer's, like medication, physical activity, stuff like that. One such medicine would be donepezil. The side effects include nausea, vomiting, diarrhea, loss of appetite, weight loss, dizziness, drowsiness, weakness, trouble sleeping, shakiness, or muscle cramps. So basically all the things that you hear in an ad commercial on TV just flying past your screen. Also symptoms you already get with Alzheimer's, which, isn't something someone would want as a symptom, but as it helps with the cognitive functions, it's just a better option for treating it. There's also really no cure for Alzheimer's at the moment, which would have been nice. There is also self-care, like I said, the physical activity. So basically doing like aerobics helps the cardiovascular system, which in theory helps Alzheimer's. And also going and talking with specialists is one of the things that is helpful with it, because there are occupational therapists which help in everyday life and at work, as well as neurologists that help treat the people who are having their nervous system constantly broken down, not in just their head, but like throughout their body. And also psychiatrists, because of the mental and physical strain, obviously. So I wanted to conclude that, although I'm really nervous, I have hoped that I helped a bit to help you guys understand understand Alzheimer's a little bit more, and also, yeah.
Thank you. Michael, what did you think?
I liked it. I liked the opening. It was very attention grabbing because it was emotional. The thesis was very reasonable, and also the organization was pretty clear in the beginning. What I liked, the visual aids, you had pretty good visual aids. You were able to explain each thing on the visual aids. And then also, I think, I know it's very nervous when you're speaking, but I think you know the information, and if you just keep a little bit more calm, you would have had no problem being able to pause. Let's see, I thought I wanted to hear a little bit more of like source material. You said like you had like I think like 2 or 3 sources. But overall, I think you did a pretty good job.
All right. I'm going to agree with you, Michael, about a couple of things. I like the attention device, also the story that you're telling at the beginning. I do think it needs to be a little bit quicker because it's almost 3 minutes before you finally get to what the purpose of your speech is, and that's a big way, a long way into the speech before we know generally what the topic is, but before you get to your specific purpose statement, there's a lot of material that comes earlier. So it probably needs to go a little bit quicker and be a little bit more to the point. There was a preview. It's a very bare bones preview, but there was a structure set up for us, so that's fine. And you were very clear when you got to that first point that we were at that first point. I didn't think the transitions were quite as clear on the later points in the presentation, although I didn't get lost. It was relatively straightforward to follow. I think you probably could have helped that out a little bit by making sure that you'd integrated your visuals along with those transitions too, so that we're getting the visual cue that you're moving to another subject at the same time. And sometimes it just felt like the visuals were occurring in the middle of the section, and it was like you just remembered there's a visual instead of it's planned as part of the speech. So you need to maybe integrate that a little bit more. I didn't hear the sources being cited very consistently. I think that's a bit of a problem. Some of the things that you talked about were okay. The visuals kind of give us a list, and there's one visual that gives us a list of kind of the behaviors or symptoms that Alzheimer's patients might have, and then you suggested that there was, that's not early onset, but that's mild Alzheimer's, and then you suggested there's something that's more severe, but the things that you suggested that were more severe had to do with other kinds of problems, like not just brain function, but physical things that happen in the body. The swallowing thing, for instance, is one of the things that you mentioned. There were several things that were there. We didn't have a similar kind of slide to indicate what those things were, and so I thought they'd kind of skip by a little bit quick. And again, this would be one of those places where a story might be appropriate, or to come back to the story of your great aunt, for instance. Maybe there were some of those things that set up the stroke that made it worse because she got dehydrated, for instance, because she was not able to swallow, or something along those lines. I just thought that it needed to be as consistent as the first set of material was. It just felt like it kind of rushed by. There is one slide there that I don't think does you very much good, and that's the Ariset slide that's got the chemical formula for the medication on the bottom. Maybe the warning label, which is what you spent most of your time on, would have been the better thing. You know, it can cause X, Y, Z, Q, R, S, T, W, X, and so on, all the negative symptoms. But I think the better thing that would have been there is to tell us what it is that it's supposed to do and how effective it is. Like you said, it's not a cure, and at best it helps people's cognitive functions for a period of time, but it's not a long period of time. I think this is a subject that needs to be justified a little bit more. At the beginning you said there's not as much research being done on it as is necessary, but I didn't hear any information that talked about how much money is spent on this, how many people are subjected to this kind of disease, how big a problem it is, and that's all stuff that's, I think, relatively easily available on the subject, and would also make your speech a little bit more substantive in the early part, not just the personal tragedy that goes along with this. I know exactly what you're talking about here. The first thing I wrote down on the visual materials is, do you have a picture of Dr. Alzheimer's and his patient? And then about a minute and a half later, you got that picture up. So I think you know that you had forgotten that one thing, and so that was a little bit awkward at that particular point. I thought you were a little bit better at things later on, but you rushed through a lot of things. For example, you've got that image of the brain, the two side-by-side images where you're showing us what the difference is. And that was up for a very brief amount of time. I barely had time to see it, much less look at the information or look at any of the details. And you don't really talk about it that much, so that seemed like it was something that you kind of zipped through. I know that you've got anxiety issues. I thought you did a perfectly fine job. It's just us. We're okay. We're happy to hear you, and I thought that you did a pretty good job talking to us, despite the fact that you had some nervousness and anxiety. It's always tough when you talk about something also that has some personal element to it, because that raises the stakes. And so here you are, nervous about having to speak, but you're also talking about something that has an emotional component to it, and we're going to be talking about speech anxiety. That sometimes is a bad mix. It's like certain foods don't go together. That's one of those things that doesn't go together very well. Maybe plan the exit a little bit more also. All right, thank you.